Hey, Danny Mattei here, founder of PT Biz, and today I'm going to talk to you about why a clinic director is willing to take a job at a cash-based clinic in a staff PT role. So this is something that I've now seen multiple times at the clinic that I started, Athletes Potential. I just was there today. I had a great visit with a fantastic clinician who has recently come on with that company. And I had an opportunity to talk to him while he was working on my back. You know, I was there to get some soft tissue work done and to get some help maintaining my health. And he was awesome. And what was cool is I had a chance to talk to him about the role he was in previously, the things that he liked, didn't like about it, and why would he take a role as a staff clinician in a cash-based clinic versus giving up the clinic director position that he was in a high-volume corporate clinic that has clinics all over the Southeast. This is not the first time this has happened in this clinic, by the way. We've actually had multiple clinicians that have done the exact same thing that are still employed there. And I'm going to talk about why you're seeing this, the unique advantage that these clinics have, and what you need to understand to lean into as well if you're trying to hire, because not everybody cares about just money. And I'm going to talk about the things that are just as important for many people, but where we also need to kind of meet them in the middle in order to be able to have compensation be comparable. So when we look at the reasons why a clinic director somewhere will give up more income in order to take a staff job, it really comes down to a couple factors. Number one, work-life balance. So the hours that you put in running a clinic as a clinic director, the documentation time, the things that go around marketing that, the staff training things, there's a lot of work that goes into that job, let alone the full-time caseload that you have, right? And this individual was telling me they were seeing not a huge volume, 15, 16 patients a day, which to be honest with you, is still a lot, but it's not maybe 10 to 15 people more than that, which the clinic that he left, I know people that have worked in the same one, the same company, and their volume is really high. You know, I would say probably closer to 20 to 30 visits is more the standard that I'm aware of. And that's a lot, right? And the thing that he told me that I thought was really interesting was the work-life balance side of things with, being married, starting a family, and wanting to be able to have energy left over for your family at the end of the day was a big driving factor. And I've been there. I understand that. Like, that's the interesting thing about it is like, I can totally relate because, whenever I was seeing high volume in the military, especially my last job when I would have sick call hours, I'd have 20 plus people come in the first couple hours of the day. And it just was like so hard. Then I had a caseload after that. I would just come home and I would fall asleep on the couch. I just wasn't a enjoyable person to be around. I had no energy left for my family. I had nothing left to sort of share with them. At the end of the day, I just was tired and just brain dead because they throw so much at you. And for him, he said, dude, it's been so cool to go home and like have a conversation with my wife, see how her day went, to be able to do things around the house that he still has energy to do, and to really have like this sort of this sense of having energy and being energized at the end of the day, come back because the work is it's still interesting with what we do in a cash-based clinic, but the volume is not quite as intense, and that's huge. The second thing is longevity of career. So for some people, here's the decision they make. Do I leave the profession and do something else? Or do I take a role in a cash-based clinic or a low-volume clinic? It could be hybrid, but a lower volume clinic, and try to extend my career by not having as much burnout from the volume. And we know that is actually, at least, I don't know if there's research that shows this, but subjectively, almost everybody that I talk to, the volume of work, the volume of visits, the high volume side of things is really, really challenging for a number of reasons, but it is very, very intense. The amount of work is very intense, and it does create a lot of burnout. So when you strip the volume down and you have lower volume, it does give people an opportunity to really elongate their career because they're not actually getting burnt out as fast. Now, the depth of conversations and people that can be really empathic can very much feel very burnt out from some of the complexity that you might see in a clinic like that, but you're going to get that in a regular clinic as well, right? So that's just kind of a personal thing. I don't think you can change that besides working on yourself to make sure that you're not taking other people's stuff on yourself, and you have compassion, but you're not like letting the empathetic side of yourself, take everybody's shit home with you. So that does create burnout, but that is more of an internal than an external reason. The third thing is clinical satisfaction. So the satisfaction of working in a clinic and enjoying using your skill set to the best of your ability, not being hamstrung by the fact that you have two people in there at one time and you don't really have the opportunity to sit down and have a conversation with somebody about something like maybe sleep or nutrition or movement, or being able to like write a treatment plan for somebody that's a little bit more elaborate, a little bit more in depth, because you frankly don't have the time to do it. And it to me, whenever I was in these settings where I felt kind of limited and constrained by the environment, it was me feeling like I had more to give. It's sort of like driving a car, and if I don't know, I'll age myself here, but like a manual, where you like shift things. That's how cars used to work. But you'd have to shift it and put it in different gears depending on how fast you were going. And if you're driving a car like that and you could only drive in second gear, you could only go so fast. And then you start like revving your engine, and it's frustrating, right? But if you're in a clinic and you can only put your skill set into second gear and you want to go and see what you can do, that's frustrating. And that will actually cause you to get very unhappy with your career trajectory. Especially if what you do is, like there are some people that what they do as a clinician is their job. There's other people that what they do as a clinician isn't a work of art to them. It's their art form. It's the thing that they're trying to be the best in the world at. That is the kind of person that you want to try to hire. That is a person who's fantastic in clinics like these. That's actually who thrives in clinics like these, because they feel a lot of personal satisfaction about being able to use their skill set and all the hard work that they've put into that to the best of their abilities and get the outcomes that people want and that they want to help them get. And they get a lot of personal satisfaction and take a lot of pride in the quality of care that they are able to give people, in the outcomes they're able to get, in the ability to be that cleanup person that nobody's been able to help this person, but you haven't seen me yet. Let me take a crack at this. And they feel very competent and confident about their ability to use their skill set. That is I would say, overall sort of theme that I see with some of the best hires we've ever made. And oftentimes they're in management roles, right? Because they've been around, they're a good clinician, they probably are punctual, they show up on time, so they get a clinic director role. And along with that comes probably a lot of administrative duties that they don't actually like. So these are reasons why people would leave to come to a clinic, but you got to meet them halfway. And there's two things that you have to have in place, or at least the trajectory to have these in place. Number one, you have to have good enough compensation, okay? And when I mean good enough, you can't have these sketchy, super low base salary, 50% of what you make is bonuses, heavily tied to volume, and you really bringing a lot of people in yourself. Like, we used to be able to get away with stuff like that. It doesn't work like that anymore. And you're really going to only attract people that are willing to take these just incredibly aggressive comp structures, which are probably very risk tolerant people, and they're not going to stick around your clinic anyway. That's not what you're looking for. So it needs to be good enough. It needs to be a salary that is good enough to where it's comparable to what they could make. Now, maybe not what they could make as a clinic director in a really high volume clinic, but you can't really compare those two things, because the amount of output you're going to get is not the same one versus the other. I mean, you're seeing that amount of volume, you're managing clinics, you're maybe getting a profit share amount from that clinic or something to that effect. You can't really compare the two, but you need to be really close to what a staff clinic job salary would be in your area. And this is where, I really feel like the advantage to a clinic that does a good job of charging what they're worth and building up their revenue per provider to a realistic amount, to a really good amount, they have an unfair advantage. Because if you can provide better work-life balance, you can increase career longevity, you can have better clinical satisfaction, you can help them have energy left over at the end of the day, use their skill set the way that it deserves. you got it, right? You got that, all those boxes are checked. If they can make what they make in a clinic, in an in-network clinic at the same time, you're going to have no issues whatsoever hiring, and it's really important to understand these pain points, because I'm sure you felt these yourself. And instead of you looking for a job, doing something else, you decide to start your own clinic. But not everybody is in an environment to do that or has the desire to do that. It's difficult. If you listen to this and you have a clinic, it's not the right path for everybody. And there's nothing wrong with that. But if you can have a job where you work with a really cool company and you feel very personally satisfied, you're able to make a good income for your family, and you can take pride in the work that you do, and you don't have to leave the profession. I think it's a fantastic compromise in many ways. And aside from the compensation being good enough, for many people, and this isn't everybody, but for a lot of people you're going to get that leave a clinic direct role, and not everybody does that, but when they do that, you also have to have opportunities, future opportunities, where they see that the company is moving in a way where they can grow with it. Now, if they take a step back and they just say, cool, I'm just going to be a staff clinician forever, maybe they hated being a clinic director, number one, and that's actually what they want. And as long as they have a compensation opportunity to continue to grow as they grow with the clinic, cool. But for a lot of them, they want to see that there's an opportunity to potentially move back into a leadership role as the company grows. And this is the interesting thing as a business owner. Sometimes, whether you like it or not, you have to grow your clinic to create opportunities for your staff. Because if you don't create opportunities for your staff, they will look for opportunities other places. And if you don't want to really grow and have multiple locations and a big team, that's fine. You make that decision. There's nothing wrong with that. That could be very well the clinic type that you want, the business vehicle that makes the most sense for you and your family and for the goals you have. But you're going to take people that are A players that they end up looking for the next thing, the next, step forward in their career. If you can't provide that for them, they'll go find it somewhere else. Maybe they do it on their own, or maybe they go and work somewhere else, right? Because they're probably pretty ambitious and they want that leadership responsibility. They want to move into a role where they're a leader in the company. So if you can create opportunities and you can grow the business, and be able to have opportunities where they can move into leadership positions in a number of ways, whatever that looks like in your clinic, then all of a sudden you can take these people that have taken a step backward with you and they see a path where they can move back into a comparable role, comparable position, and a comparable amount of income. And if they see that, now all of a sudden you basically got a perfect recipe for the ability to be able to hire most people that come your way that are the right fit for you. Right? Like, hiring is incredibly complex, important part of the business, and getting it right is such a vital part of not seeing a big step back in your business. One of the bigger problems we see is if people make a bad hire and then that person turns over within like 3 to 6 months. I mean, it's just one of the biggest things that stalls the growth of your business. So if you can have the right hires and you can give them the right pathway forward, even if you have retention of 3 years with a provider, like, that's not that long, but damn, that is a game changer for you in terms of the ability to continue to grow your clinic. And obviously, if you create an environment, you hope that people stick around for as long as they want to work, and that you continue to have great, work-life balance for them, and they love the culture and they are really proud of the business they get a chance to work with. They have opportunities to grow if that's what they want to do. That's the ideal environment. That's the cash-based clinic utopia that so many of us are trying to work towards. And the net reality of that, to just be completely honest, comes down to one thing. And it comes down to your ability to charge what you're worth and to generate enough income to where you can do these other things. You need enough income per provider so you can pay them well enough without killing your margins. You need enough income per provider so that you can afford to have a cool space and a space that you can build out, and it's a place they want to come and they feel proud to tell people they work there. And when their family comes there, they think, what a great place to work. You have to have the revenue per provider to be able to pour back into them with benefits, to provide continued education, to have generous programs in terms of them taking vacation, to have things like 401k and benefits in place that they want and they need. And It's what big businesses do. They put their big boy, big girl pants on and they provide real things in a business. And you have to grow into that. You can't start with that whenever you're in a subleased office in a CrossFit gym or whatever. That doesn't start there, but eventually you have to get there if you want to attract the right talent, the best talent in your area that's looking for these things where they have work-life balance and career longevity and they can use their skill set the way they want, but you have to meet them halfway with compensation that's at least comparable or close to it and a path to where they can get back to something that they're leaving, so that they can see growth in their own career as well. And this is a really cool time, I think, if you have a clinic that is, a bit more established. If you're just starting, you're obviously not going to hire somebody that was a clinic director somewhere because they don't trust that your business is going to be around, right? But if you've been around for 5 to 10 years and you have a track record of being there, like the stability of that is actually quite attractive to clinicians. Because guess what? Clinicians aren't the most risk, tolerant group of people. We typically are very risk averse. We want security. You don't go into physical therapy thinking you're going to make $500,000 a year. That's just not really how it works. And that's cool because the career is very personally rewarding. And as long as they make good income and they like where they work, most people are totally cool with that. And they're happy with that. So, you have this opportunity if you get past this stage where you're small and you're viewed as a little more risky, which I think is the hardest stage, this starting to growing past yourself to your first 1 or 2 providers and building out a standalone space. There's a lot more risk associated with that than there is expanding once you have 4 or 5 providers and now you're going to open up another office. You already have proof of concept, you have a reputation, you have a lot of cash flow from the business and the stability of it. So there are plenty of opportunities to grow past that and to really attract these talented candidates. But getting there, that's step 1, right? Step 2, you got to really, really meet people with the right benefits, the right comp packages. And don't forget when you're interviewing somebody, these questions about the work-life balance side of things, the things that they want to be able to do, the energy they want to be able to have when they're not there. This is what drives most people to want to make a change and come to a clinic like this. It is your superpower. It is such an advantage. Don't leave that on the table. Please, God, talk to them about this because that is a huge decision maker for them. And if you skip that conversation because you're uncomfortable with what that might feel like to have a discussion on that level, man, you are dropping the ball on being able to acquire fantastic talent in the business that can work with you as a team member. And keep in mind, I never, ever say someone works for a business or for a business that I have. I think it's a terrible way of describing the people that work with you. These are team members. They work with us. We all have different jobs. We all have different roles, but we work together, period. And for you to attract people like that, you have got to be able to have discussions with them about things that are the human element of them, of the life that they want that has nothing to do with their credentials, what school they went to, the volume that they can see, compensation, all that. Let's have a discussion about what do you want your life to look like? Is this the right fit for you and for the clinic that you're looking for? Because if it is, cool. We would love to go on that journey with you and you can be a part of this culture in this company. And if not, it's great to know that too, because we'd rather not bring the wrong person in and you'd rather not make the wrong decision. Saves us both a lot of heartache and time. So that's it. I'll summarize real quick with this. You are in such an advantage as a cash-based clinic, in particular if you have low volume and you have a great work-life balance and culture, period. It is your huge advantage over in-network clinics. If you can be even close as far as comp goes, you're not going to have a hard time hiring people or getting talented people that want to work with you. The hardest part is going to be that first sort of 3 to 5 years where people just don't know if you're going to be around. They view you as risky. Once you get past that, if you really want to grow, that's the stage to lean into it from a standpoint of really being able to hire. But make sure you're talking to them about the things that are important to them and you're meeting them with compensation that is reasonable and that they see a path to continue to grow. So I appreciate you watching and listening. If you've been listening for a long time, thank you so much. The person who I saw today, ironically, listens to the podcast. So shout out. Thank you so much for listening. I won't shout you out by name, but I really appreciate it. I really appreciate your help today. Fantastic manual therapist. So thank you so much. And as always, thank you so much for listening and watching, and I'll catch you next time.